contains two parts. Contains two parts, oral cavity. Oral cavity contains two parts, vestibule, and proper oral cavity. Proper oral cavity. Vestibule bundle is anterior lip, okay? Posterior teeth, okay? Arch of teeth, superior and inferior mucosal, okay? Between of the vestibule and proper oral cavity. It's not very, very easy, okay? Vestibule, just opening of the carotid duct, opening of the vestibule, intervestibule. This vestibule, this part vestibule. Anterior lip. Anterior part of the lip. Posterior teeth. Okay, superior mucosal and frenulum of upper lip, and inferior frenulum of lower lip. This part, smallest part, vestibule. Okay? Just opening of the parotid duct, interovestibule opening. Interovestibule, okay? Parotid duct. Parotid papilla with opening of parotid duct. Parotid duct opening proper oral cavity or vestibule. Final question. All of secretion of the salivatory gland, opening of oral, proper oral cavity, except just this is this duct opening of the vestibule. Just opening of the vestibule. Of the oral cavity, lateral oral vestibule. Okay? Vestibule. Vestibule. Okay, vestibule. Okay, vestibule, and another part, proper oral cavity. Proper oral cavity contains boundaries, anterior boundaries, this, okay, anterior. Posterior, very good, oropharynx, anterior, this, anterior, posterior, oropharynx, and inferior tongue. Okay, inferior tongue. Superior tracheocollar. Okay.
This is all in vestibule?
Yes. This is proper cavity. Oral cavity. Vestibule, just landmark opening of the parotid duct. Proper cavity. Proper cavity, posterior oropharynx. Anterior is superior palatine, subpalatine, and half palatine. Inferior tongue. Okay, inferior tongue, filtrum of lip, uvula or small tongue, another name uvula, palatopharyngeus arch, This is palato, this one palato pharyngeus arch, and palatoglossal arch arises from, origin from subpalatine insertion tongue. And this is palatopharyngeus, origin from palatine insertion trunks, between of the palatopharyngeus arch or fold and palatoglossus, location of tonsil palatine. It is tonsil palatine. This part tips. Okay, pass.
Yeah.
Which block?
GI.
Block.
Yeah.
GI.
GI.
Yes.
Yes.
Okay. This contain palatine, palatine muscles, hard palatine formation from palatine process of the maxilla and transverse plate of the palatine bone. Okay, but soft palatine formation from any muscles, structures of any muscles, and is two group is. Okay, it is two group. This deciduous and permanent. Deciduous, what's the meaning deciduous? Temporary. Temporary. Okay, and permanent. Okay, two group is deciduous group, deciduous or primary permanent, permanent or usual of eruption. Permanent deciduous contains any is deciduous contains any
20.
deciduous.
Or is
Deciduous 20, okay. Deciduous. Deciduous is deciduous. Okay. For quadrate superior, one for superior left and superior right, and one for superior left and right inferior. Okay. Deciduous is centralis, lateral, central incisor, lateral incisor, canine, first molar, second molar. All of 5, okay? 5. And 5, and 5, and 5, the same. All of the deciduous is 20. Okay, 20. Incisor. Central incisor. Central incisor is lateral incisor. This is canine and first premolar, and this is second premolar. Excuse me, molar. molar. Okay, odor, molar, and hermenant, hermenant. The same part, this part, central incisive, lateral incisive, canine, first premolar, second premolar, first molar, second molar, third molar. Okay? Permanent. Permanent. 1, 2, 3, 4, 5, 8, 8, 8, 8. Okay? This part deciduous, this part permanent. Okay? These contains three. These 1 and 2, 3. These contain 5 surface. Okay, 5 surface. This is surface near of the midline, mesial. Okay, mesial. Surface of the piece. Okay, surface of the piece. Okay, near of the midline, mesial surface. Mesial surface. Did you understand? Okay, and away to distal surface. And the surface connected by labial and palatal, labial or palatal surface. Labial or labial or vocal. Labial or vocal. This part vocal. Vocal surface. And internal surface connected by lingual and palatine, lingual and palatine surface. Okay, surface. And another surface, okay, connected, occlusal, superior surface, okay, occlusal surface. 5, occlusal surface. Yeah. This no difference. All of these contains 5 surface. Okay, and another part, innervated and artery. Innervated and artery, blood supply and nerve supply of the blood supply, blood supply and nerve supply, please. Okay, the central incisor, lateral incisor, canine, molar first, 2 molar, premolar 1, 2, first molar, second molar, third molar. Okay. Largest or longest root, canine. Okay, canine, longest root, canine. Nerve supply of the upper part, nerve supply, central incisive, lateral incisive, and canine, blood supply by anterior, superior alveolar artery. anterior, superior, alveolar artery. Central, this is a lateral, this is a canine, and sometimes molar. And molar, nerve supplied by posterior, superior, alveolar artery. Okay. And this part, central, lateral, canine, first molar, second molar, first canine, second molar, premolar, molar. Okay. Blood supply. All our blood supply. Blood supplied by which artery?
Inferior alveolar.
Inferior alveolar artery. Inferior alveolar artery. Oh, okay. And the nerve supply central, lateral incisor and canine. Nerve supplied by anterior, superior, alveolar nerve, okay, and precanine, two precanine. First and second, nerve supplied by middle, superior, alveolar nerve. Okay, and molar, first, second, and third, nerve supplied by posterior, superior, alveolar nerve. Okay, and but nerve supply of this part, olar, nerve supply, inferior jaw part. Inferior alveolar, where branches from mandible, branches from maxilla, branch maxillary. Okay, thank you. This part, inferior alveolar nerve, branches from mandible. Okay, finish. Olar, nerve, very important nerve supply and blood supply of the teeth. Okay. Labia, gingiva, what's the meaning, Okay. Gum. Upper part, gingiva, okay. Nerve supply or sensitive or sensory part, anterior, superior, alveolar nerve, and the same. Nerve supply, the same of this gingiva, okay? Innervation of gem or gingiva. The same gingiva. Okay? The same, okay? All our artery and finish this part. No problem. Here.
Just a question, the inferior teeth are innervated by the inferior alveolar nerve.
You
Same
said
as the
no.
blood supply, correct?
Yes?
Thank you.
That means the morphology is morphology. What's the meaning morphology?
The way it's formed.
Okay, morphology contains three parts. This morphology. Okay, this part, boiling, alveolar bone, spongy bone. Okay, spongy bone. Morphology contains three parts. This part chrome, this part gel, this part root. Okay, morphology, morphology. Okay, this morphology contains three parts: crown, gel, and root. Okay, but structures contains any part. Structures, enamel, upper part, hardest part, enamel. Enamel. Okay, and another part, dentine. Okay, dentine, two, dentine. Okay, dentine, three, pulp cavity. Pulp cavity, three, pulp cavity, and root canal, and this part, periodontal ligament, ligament, and another cementium, seven apical foramen, structures of the toes. Okay, structures. Did you understand? Enamel, hardest part of the toes. Okay, but the largest part of the is dentine, pulp cavity, root canal, periodontal ligament, cementium, apical foramen, and from contains three part morphology. Eruption of the deciduous central incisor, 8 and 10 months. Lateral incisor, 8-10 months. The same canine, 60 or 20 months, 14 or 21. Okay, no problem. And this part, permanent, very, very important, permanent, first molar, because eruption of 6 years. Okay, which permanent toes sooner of the eruption?
Postmolar.
Which?
Postmolar.
This is this one. This one, first molar. Thank you. First molar. Very important question final. Which permanent toes sooner eruption, another this is because first second molar 20 or 30 years eruption, but first premolar 9 year eruption or 210, but for 3 molar 20 70 or 25 years eruption, but the sooner first molar 6 years. Very important spot.
Do we have to memorize the number of the other ones
Yes.
as well?
No. Did you understand this part?
Yes.
Yes.
Again, question?
He's asking if we have to remember all of the years that all the peaks erupt. So no.
Yes. The eruption?
Yeah, do we have to memorize?
For the exams.
Just
For the exams.
Oh,
We have to remember it for the exams.
yeah, remember exam.
Like all of them? All of them?
All of, no, first, no,
Okay,
no,
okay.
no,
No, just the molar.
just one, okay,
Okay.
just one.
Okay.
First molar. All of memory of the very difficult, okay, not the importance, okay. And another part, this part, crown, neck, the same of neck is part, gentle neck, okay. Attachments of gem of neck, crown, root, and this enamel, dentin, pulp cavity, this part, root canal, and apical foramen, cement, predentium or alveolar predental ligaments, and gingival groove, root of the teeth. First, upper central incisor, one root, lateral incisor, one root, upper canine, longest root, and upper premolar, first 2 root, second 1 root, all of upper molar 3 root, and all of lower molar 2 roots, and another central incisor, lateral incisor, canine, first premolar, second premolar, just 1 root, and another part palatine, hard palatine and subpalatine. Subpalatine contains any roof of mouth. Subpalatine contains any muscles. Which muscles of the all of muscles of the subpalatine? 5 muscles. 5 muscles. Muscles of the subpalatine. One tensor, very palatini muscle. 2 levator, very okay, palatini muscles. 3 palatoglossal muscle. Okay, palatoopharyngeus muscles. 4 ulnar masters. Contains any masters?
Five.
5 masters. Origin, insertion, and action. Okay. Tensor veri palatini masters, levator veri palatini. All of masters innervated from. Vagus, okay.
Vagus.
Pharyngeal plexus. Pharyngeal plexus. Okay. Pharyngeal plexus formation from pharyngeal branch of vagus. Okay, vagus. And two, formation from cranial root of accessory nerve. Okay, all are innervated from two nerves, vagus and cranial nerves. Vagus and cranial nerves. And the pharyngeal plexus, another formation from pharyngeal branch of CN9, and formation from some parasympathetic and parasympathetic. Okay, pharyngeal plexus formation from any nerves, 5. Pharyngeal branch of vagus nerve, motor fibers. Cranial root of accessory, motor fiber. But pharyngeal branch of CN, sensory. This is parasympathetic and parasympathetic. Then innervated from pharyngeal branches of vagus and motor and cranial root of accessory. All are muscles of the subpalatine, nerve supplied by which plexus pharyngeal, which branches vagus and cranial root of accessory, except all are innervated this part, except tensor innervated from which part? Trigeminal, very good. Which branches? Trigeminal? Okay, good, very good. This innervated from trigeminal, mandibular, and main tongue. Mandibular nerve, main tongue. Oval foramen, mandible, okay, main trunk, anterior deviation, posterior deviation, innervated this part. Okay, did you understand? All of muscles innervated from pharyngeal plexus. Pharyngeal plexus formation from any nerves. Pharyngeal nerve of vagus, cranial root of accessory, pharyngeal branch of CN9, sympathetic and parasympathetic, just nerve supply of the subpalatine from pharyngeal branch and cranial root, except tensor veli palatini muscles. Tensor veli palatini muscles, nerve supplied by mandible, trigeminal. Palatine and uvula. Okay. Tensor veli palatini, origin from 3 parts. Tensor veli palatini muscle, origin from scaphoid fossa to sphenoid process. three lateral surface of cartilaginous lateral surface of the cartilaginous of the auditory tube. Auditory or pharyngeal-tympanic tube. Pharyngeal-tympanic tube or auditory tube or Eustachian tube. Three part, 1, 2, 3, okay. 1, 2, 3. Formation of this part, palatine aponeurosis. Palatine aponeurosis. Okay. Origin is tensor really palatine muscles. Origin from three structures: scaphoid fossa, sphenoid process, lateral surface of cartilaginous, pharyngeal-tympanic cartilaginous, pharyngeal-tympanic tube, another name auditory tube or Eustachian tube. This tube, middle ear, this tube, middle ear, they say middle ear, okay, this part tube, first part of tube, bony, and another, okay, cartilage. This tube, connection, middle ear and environment, okay, contains two parts. This part, bony, this part, cartilage. Okay, lateral surface of cartilaginous part. Cartilaginous part of pharyngeal-tympanic is pharyngeal-tympanic. Tympanic, pharynx. Between of the pharynx and tympanic. And the action elevated of uvula. Elevated of uvula. And another muscles, levator vieli palatini. Levator vieli palatini. Okay, origin from two parts. Which part? Inferior surface. Inferior surface of the petrous. Inferior surface of the petrous. Inferior surface of the petrous part. And two, which part? This part, lateral surface, this is inferior surface. Inferior surface of cartilaginous part or pharyngeal-tympanic. Pharyngeal-tympanic, another name. Auditory, Eustachian, and pharyngeal-tympanic, three, the same name. Okay? These muscles, levator, vieli, palatini muscles, origin from two structures. Which structures? Inferior surface of cartilaginous part, pharyngeal-tympanic tube or auditory or Eustachian, and another inferior surface of the petrous. Action elevated of uvula. And another muscles, another from scan and France. Another another muscle, palatophrons. 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 Origin palatine, insertion flanks. Okay? Palato is palatine. Palatophrons. Subpalatine. Palatophrons. And another palatoglossus. Origin palatine, insertion glossus. Palatophrangus, palatoglossus. Between of the palatophrangus and palatoglossus, which structures location? Tonsil. Thank you. Tonsil. 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 Okay. Between of the palatophrangus muscles and palatoglossus muscles, tonsile. Tonsile. Palatine. Okay, tonsile. And 5 muscles, uvula. Uvula, 5 muscles. Origin from posterior border of hard palatine and posterior. Spine, nasal, posterior spine nasal is muscles. Insertion uvula. Insertion uvula. Origin from posterior border of hard palatine, and to posterior spine, nasal, posterior nasal spine, insertion uvula, muscles, okay, muscles, uvula, origin from posterior border of hard palatine and posterior nasal spine, insertion mucosal of uvula, action elevated of uvula. Oral nerve supplied by pharyngeal plexus, except tensor very palatine. Tensor very palatine questions, final questions. Which all of muscles nerve supplied by pharyngeal plexus except tensor very. Did you understand these muscles? Okay, these muscles. Tensor very palatine muscles. Tensor very palatine muscles origin from scaphoid, sphenoid, okay, scaphoid fossa, thank you, sphenoid process and lateral surface. This part, cartilaginous part of pharyngotympanic or adviatory tube, okay, insertion, formation tendon of tensor very palatine left and right, formation aponeurosis. Okay, and another muscles, levator very palatine muscles. Levator very palatine muscles origin from inferior surface of petrous and inferior surface of the cartilaginous part. Insertion aponeurosis. And another muscles, uvula. Uvula origin from posterior nasal spine and posterior border of hard palatine. Insertion uvula. Palatophrangus muscles origin from palatine, insertion pharynx. And another palatoglossus. 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 Palatoglossus is palatoglossus muscles origin palatine insertion, tongue. Between of the palatoglossus muscles and palatopharyngeus muscles, location of the palatine conceal. Palatine conceal. Did you understand this part?
Yes.
And another structures interoral, proper oral cavity, tongue. Another structures, tongue. Tongue and other structures. Tongue contains two surfaces, dorsum and anterior or ventral. Tongue okay, tongue contains apex, this part apex, this part base, between of the this part oral part, pharyngeal, geal part, sulcus terminalis, and foramen secum, sulcus terminalis, foramen secum, foramen secum, foramen secum, foramen secum, and medial fissure, or medial groove, medial fissure or medial groove, or groove. And this part, root, posterior part, root. Okay, root. Contains the oral part, pharyngeal part, and root. Okay, root. Two border, left and right border. Tongue contains two surfaces, dorsum, upper part dorsum, lower part ventral. And left and right border, apex and base. Okay, our dorsum contains any papilla, can consist of any papilla. Consists any papilla. Papilla of dorsum Circumvallate, okay, vallate, papilla. 2, filiform papilla. 3, folate papilla. 4, fungiform papilla. But inferior surface free of the papilla. Inferior surface free of papilla. Valate papilla. Folate papilla. Filiform papilla. Or fungiform papilla. Okay, fungiform papilla. Circumvallate, filiform, folate, fungiform. Okay, and innervated, testing this part and sensory. Sensory and testing this part. 2 type, 1 type, and root. This part sensory nerves and testing. This part sensory and testing nerves. This part sensory trigeminal, CN9 lingual, trigeminal, CN5 trigeminal, and testing CN7. Testing CN7 chorda tympani. But this part sensory CN9, testing CN9. CN9. Close fraction. This part sensory CN10, testing CN10. Okay? CN10. Lung, sensory nerves and testing nerve. Sensory nerve 2, 3, top. Sensory from CN5, testing CN7. CN7. And one time, sensory CN9, testing CN9, root CN10 and CN9. Okay, all of CN10. Okay. And another part of the tongue, muscles. Muscles of the tongue, extrinsic and intrinsic. Teach this part. Okay. Yes? Yes, Abraham. Teach. Okay. Yes?
No, but we just studied the names of the muscles, not the origin itself.
Okay. Good, this part. No problem. Okay. Another part, muscles of the tongue. Muscles of the tongue, 2 groups. Extrinsic muscles, extrinsic muscles, stylo, okay, glossus, thank you, 2, genioglossus, 3, hala, 2, glossus, 4, hyoglossus. And intrinsic, superior, okay, superior, muscles, okay, and 2, inferior, and 3, vertical, and 4, transverse, okay? all of muscles, nerve supplied by all of muscles of the tongue, nerve supplied by hypoglossal. Excellent. All of nerve supplied by hypoglossal nerve. Excellent. Which muscles? Palatogloss. Okay, palatogloss. Nerve supplied by which palatogloss? Nerve supplied by which nerves? Vagus. Which branch? Pharyngeal branch and cranial root of CN. No, CN11. Pharyngeal branch, vagus. Okay, vagus. Pharyngeal branch of vagus. Okay. This part. Styloglossus, origin from styloid, insertion, tongue. Genioglossus, origin from superior mental spine, insertion, tongue. Palato, origin from palatal, insertion, tongue. Hyogloss, origin from hyoid bone, insertion, eye. Okay, superior longitudinal, origin and insertion, tongue. Inferior, origin and insertion, tongue. Okay, transverse, origin and insertion, tongue. Okay, and vertical. Okay, all up. This function, superior longitudinal, apex of contact by palatal. Okay, and okay, dorsal. And inferior,
Depression.
okay, depression, tongue, and contact by, okay, roof of, floor of oral cavity. And vertical function, flap of the tongue, flap of tongue. Transverse, narrow of the tongue, narrow of the tongue. Okay, narrow, possibly narrow, not narrow, okay, narrow. Okay. Styloglossus, elevated of tongue. Genioglossus, outer or exit, okay, tongue. Palatoglosssus, okay, elevated of tongue. Hyoglosssus, depression of tongue. All of nerves supplied by pharyngeal, all of hypoglossal, seven muscles innervated from hypoglossal nerve except palatoglosssus. Okay.
Minutes to off.
Tamam, şurada.
Okay, yes.
2 minutes finish this part. Okay. Okay. Median groove, fungiform papilla, followed papilla, filiform papilla, valid or circumvalid papilla, and the root. Okay. Another tongue. Genioglossus, origin genioglossus, styloglossus, hyoglossus, hyoglosssus. Hyoglosssus, relation by any structures. Which structures? Hyoglosssus, superficial surface relationship by any structures. Lingual, submandibular ganglion, superficial surface of hyoglossus, relation by any structures, 4 structures. 1, lingual, 2, submandibular gland, 3, submandibular tongue, 4, hypoglossal nerve. But deep surface, relation by 3 structures. Lingual, R3, glossopharyngeal nerve, esphenomandibular, this ligament stylohyoid ligament. Stylohyoid deep surface of hypogloss, relationship by three structures: lingual artery, glossopharyngeal nerve, and stylohyoid ligament. Stylohyoid ligament. Relation. Okay. Lateral surface of hypogloss muscles. Relation by any structures. Which structures? Upper lingual, okay, and submandibular ganglion, and this part cut, and submandibular duct, and hypoglossal nerve. Hypoglossal nerve together by vein. Which vein? Venous committance of hypoglossal, this vein. Deep surface of the hyoglossus, relation by any structures. Deep part. 3. Phrase. Lingual artery. This artery. Lingual artery. Lingual nerve, relation by superficial surface, but lingual artery, relation by deep surface. And another glossopharyngeal nerve and stylohyoid ligament. Stylohyoid ligament. Okay. These muscles transfer superior longitudinal muscles, inferior longitudinal section of the coronal section of frontal section. Superior longitudinal muscles, and inferior longitudinal muscles, and vertical and transverse muscles. Okay, finish this part. Practice. Okay, 10 minutes rest, then starting of the practice.